Hi students, today we are going to see about Indian Public Health Standards, primary health centers, that is rural centers, urban primary health centers and specialist urban primary health centers. So under the new Indian Public Health Standards 2022, what are the changes from the year 2012 IPHS standards to Indian Public Health Standards 2022? What are the changes we are going to see? So here you can see clearly. This is a health and wellness center, primary health center, and what they are saying is all PHCs should be made functional as 24/7 PHCs. But however, there is no need to prioritize the PHCs conducting deliveries to function as 24/7 health and wellness center PHC. Like that they are saying. So all other PHCs should continue to provide routine care along with preventive and promotive functions of any primary health center. Similarly, the urban health and wellness center PHCs, they also they provide round-the-clock emergency and secondary care services. This is because of the presence of higher level of healthcare facilities. And here also they have told like UPHCs with indoor beds already conducting deliveries can continue to function as 24/7 urban primary health center and health and wellness centers. All other urban PHCs will be providing round-the-clock emergency and secondary care services because of the availability of other healthcare facilities nearby, availability of all the resources nearby. And there is another concept under the new revised IPHS 2022 is specialist urban PHC polyclinic in urban areas. These are multi-speciality urban PHCs. Here they provide the most important point here is ambulatory daycare services. Specialist services are provided as a ambulatory daycare services. So they don't provide round-the-clock services. They provide only the outpatient care. OPD care is given. And so what is the population covered by rural PHC? Of course, as before, it is 30,000 in rural areas, and in hilly and tribal areas it is 20,000. What is the population covered by urban primary health center? The urban primary health center UPHC covers a population of 50,000. And what is the population covered by specialist urban primary health center? That is a polyclinic in urban area. This is 2.5 lakhs to 3 lakh population is covered by the polyclinic in urban area. Now next is under IPHS 2022, the number of beds covered in PHC essential is 2 beds. Bed requirement at a PHC in rural area, and desirable is 4 beds in rural PHC. In urban PHC, again 2 daycare beds is very essential. Desirable is 4 daycare beds. And in 24/7 urban PHC, that is UPHC 24/7 which conduct a delivery, essential is 6 beds is required and desirable is another 4 beds. See, this is quite interesting. This is like a corporate setup, a hospital setup. They have put service flow at PHC or urban PHC, how it should be. The service flow should be like first inquiry, then registration, waiting area, doctor consultation room, injection room or a dressing room, laboratory, doctor consultation room, pharmacy, exit. So there is a framework for service delivery, service flow at PHC. And like in olden days, now they have set a target. What is the minimum requirement? Minimum performance requirement for human resources for health. That means a specialist, how much he has to perform, how many cases he has to see, that should be recorded. That is the main thing here. So here the general medicine is a staff. So then he has to see minimum of OPD of 60 patients per day and invasive procedures 10 procedures per week. OG specialist OPD of 60 patients per day. Pediatrician OPD of 60 patients per day. Invasive procedures 10 per week. Ophthalmologist 60 patients per day. Dermatologist 60 patients per day. Psychiatrist 20 to 30 patients per day. Here it is reduced because not many mental health patients come to clinic. Medical officers, they are supposed to see MBBS graduates. They are supposed to at least 75 patients per day, and IPD 10 patients per day. And medical officer dental is also posted in PHC. He has to see OPD of 20 patients and dental procedures of 8 to 10. That is, they have to spend at least 30 minutes per patient. And staff nurse, they are supposed to, as per INC norms, the staff nurse, Indian Nursing Council norms has to be followed. medical and laboratory technology lab technician, they have to do minimum of 100 tests per day using semi-auto analyzer and 200 tests per day using auto analyzer. Physiotherapist, 15 to 20 physiotherapist intervention per day, that is 15 to 20 minutes per service. Counselor is also there in PHC, 20 to 25 counseling sessions should be given by the counselor. Group interpersonal per day, 10 to 15 minutes per patient should be spent by the counselor per patient. Optometrist or ophthalmic assistant, they will be in PHC. They have to see 30 to 40 cases per day and 10 to 12 minutes per patient. Dental assistant, they will be assisting the dentist during the dental procedure. Pharmacist, the pharmacist, 120 dispensation of prescription per day and maintain stock register, store inventory management. So this is the manpower as well as what is required from that manpower is given in the Indian Public Health Standards 2022. What is Comprehensive Primary Healthcare Services, CPHC? It's a very important question these days. Comprehensive Primary Healthcare Services. The 12 packages envisaged under Comprehensive Primary Healthcare Services. The 12 packages are: first, care in pregnancy and childbirth; second, neonatal and infant child health services; third, childhood and adolescent health services; fourth, family planning contraceptive services; fifth, management of communicable diseases under the national health programs; sixth, general OPD care for acute simple illness and minor ailments has come as a sixth point; seventh, screening, prevention, control and management of non-communicable diseases. Communicable, non-communicable, one point. Care for ophthalmic and ENT problems, third point, another clinical issue. Basic oral health care, fourth clinical issue for dentist. Elderly and palliative healthcare services, sixth. Emergency medical service including burns and trauma, seventh. Screening and basic management of mental health ailments, 8. So we have among the 12 services, 8 services focusing on the clinical aspects of various diseases. The first 4 basically concentrating on mother and child health services. In this way, you can remember 4 plus 8, 12 is the comprehensive primary healthcare services. See, even in primary healthcare services, I told bed is essential. So when there is a bed capacity, say for example in a rural primary health center, if there is a 6-bed capacity is there should be oxygen cylinder, there is oxygen support. There should be 1500 liter oxygen cylinder, at least 4 cylinders should be there. Oxygen concentrator, a 10 liter oxygen concentrator should be there, at least 1 should be there. Similarly for urban primary health center and 24/7 urban primary health center, UPHC we have the same 641 requirement. For 24/7 UPHC with a 10-bed capacity, there is a need for 5 oxygen cylinders. Finally, because the government is spending so much of money for developing this primary health center level, under IPHS, evaluation is very essential to maintain the quality. National Quality Assessment Standards. National Quality Assessment Standards certification is very essential. For this certification, there is at a district level, state level, there is a committee set up for quality check. So they will do the quality check and they will give you the NQAS certificate for each public health facility, primary health center, rural, urban and polyclinics. So I hope the new revised guidelines of IPHS 2022 regarding PHCs was useful for you. I just gave you a snapshot for you. If you want to read the detailed guidelines, you could go through the document which is available free in the National Health Mission website, nhm.gov.in. If you find this video to be useful, press the like button and share it with your friends who are preparing for an exam. Kindly subscribe our channel Community Medicine Made Easy. Kindly become a member of this channel to watch many videos regarding community medicine. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan.